I'm Jessie Gold. I'm an assistant professor of psychiatry at Washington University in St. Louis and a founding member of Time's Up Healthcare, and I'm also on the steering committee.
And I'm Cyrus. I'm currently a Gene Spurlock Fellow, so I've been working on the Hill for the past 9 months or so. I'm also an assistant professor at Johns Hopkins Medicine.
So Callie and I are going to talk a bit about Time's Up Healthcare, which is a movement we're both involved in, but we thought it would be helpful to kind of talk about how we came to the movement, but also how we came to be friends first. Callie, do you want to explain that?
Yes, and I guess I failed to mention that I'm also a founding member of Time's Up Healthcare, and that will make sense more.
I think so.
Yeah. So Jessie and I met, I think, my third or fourth year of residency in Puerto Rico, actually. And I just remember hearing this person laughing really loudly throughout the hotel, and it turns out it was Jessie. And I don't really know what happened after that. It was just like we've been friends since.
Totally.
Yeah, so at conferences and at these kinds of things, it's always nice to have a friend who's loud like you, who loves karaoke like you. And so, wait, how many years has that been? 2016, 17?
18, 19, 4?
4 years
Probably
or so.
4 years.
Yeah.
I think it's one of those things too where we're both we're really involved in APA and interested in advocacy, but had very strong opinions about what they should be doing and how to be an advocate in psychiatry.
Right. Yeah, and we were doing this mostly in separate circles, but at the same kind of place, if that made sense, yeah.
Yeah, and had mentors in common too.
Right.
Yeah.
Right.
Which was helpful.
Yeah. And so my work was mostly in race and intersectionality and difference and those kinds of issues.
And I was working a lot in physician wellness, med student mental health, and also was doing a lot of freelance writing on gender equity and my experiences in healthcare.
Right. And then we were both on the job market around the same time. So that was also something that unified us.
Yeah, absolutely.
Yeah.
I'm one of those people who really pays attention to entertainment and celebrity gossip probably more than a person in psychiatry should or a physician should.
Yeah.
I was watching television and I saw the Golden Globes and saw all of the people in Hollywood wearing black and saying no, we don't agree with this harassment in Hollywood. And at the same time was on Twitter with a bunch of very vocal women who were talking about the exact same issues in medicine. A lot of those women are now in Time's Up Healthcare, so people like Esther Chu and Jane Vandis and Derek Haas, and they were talking about all the work they were doing at the exact same time that it was going on in parallel in Hollywood, and we were saying, why are we not talking about this together? It's very similar to how Hollywood decided to amplify the voices of the farm workers, and they said, well, we have this platform, we can say it's not okay what goes on for farm worker women. And so we said, very similarly, we have this going on. We don't have platforms like the Hollywood women, but we have very similar problems. So we reached out to Time's Up, and they actually agreed with us. And they said, you're right. You have a lot of problems. You are 1/6 of the economy of the U.S. in healthcare, one of the biggest employers of women, and also one of the people who, one of the groups that are having the most people go to the Legal Defense Fund asking for help. So the Legal Defense Fund was set up by Time's Up proper.
And that was already out?
That was already out. That came out with the Golden Globes. And the purpose was to be able to help people who can't afford to bring about harassment and inequity cases and to raise money. I think they've raised somewhat like $21 million at this point to help people. And they wanted to be able to say, these people can't afford to bring about these suits. These people work at McDonald's. These people are cleaning houses. These people are healthcare workers in positions where they're not making a lot of money because they're working in home health or something like that.
Yeah.
And they wanted to help them. And after people in Hollywood, healthcare workers were the second largest group bringing cases to Time's Up Legal Defense.
Which I didn't know until recently.
Right, which is huge.
Yeah.
And so they were like, well, obviously this problem's already coming to us. So you're right, we should partner on this. And that's sort of where Time's Up Healthcare originated. Obviously, then we all had to kind of come together and figure out who were these founding members and what are we interested in doing. But that is where it came from.
That's cool. I only remember texting with Jessie, saying, and her mentioning she was doing some Time's Up stuff, and me not really asking many questions just like thinking about, okay, it's like this Me Too white girl kind of movement thing again. And even after watching, that's where Oprah gave the speech, right? At Golden Globes.
Yeah, I think so.
Yeah, I think there were quite a few women, but even then I was pretty disconnected from it because I just remember thinking, I don't know that I identify with these women as someone who's queer and black, even though I love to identify with anything that Oprah does in general. Yeah.
And what actually made you decide that you wanted to be a founding member?
Well, one, you asked me. What made you reach out and ask me? Because I remember it was some time in between when you first joined and when we actually probably had a more detailed conversation about it.
I mean, I think that you're the person who taught me the most about the intersectionality of pretty much everything in medicine. I think that I didn't really understand a lot of that myself from a position of privilege as a white woman who grew up financially privileged too, who then went into medicine, which is a financially privileged profession, and wasn't exposed to a lot of the same things that you were. And you would say, Jesse, like, this is going on. Jesse, open your eyes. Jesse, let's have a conversation about that. Or, Jesse, you shouldn't say that. And I felt like I learned so much about, how to exist in a world where I was lifting people up in the right way. And I think the way that you made me think was a way that I wanted you to make the organization think. Oh. And I don't know if I've ever told you that.
No, you haven't told me this.
But I felt like I always learned so much by hearing from you, and I really wanted the organization to have a voice like yours telling them, like, don't forget about this whole issue that you sometimes neglect, or remember that while you're talking about women, there are people who don't identify as women who are having the same issues, or that black women are paid less, and you're talking about pay equity. You can't say, well, pay equity for who, all women, or are you talking about a specific part of the population? And I think we needed that, and we need someone to say, even though we were very interested and really hoped to be working on that, we needed someone to be pointing that out to us and saying, like, hey, you remember how you're interested in that and how that was important to you? Just remember, we need to, like, be careful on the wording and be really thoughtful about what we're doing and why. And so that was why I was really hopeful that you would join, but I know that you still had hesitation for a while.
I did. Well, one, I didn't know all that. I want to give you.
Oh, okay.
That's interesting. Yeah. Well, I reluctantly joined, which you know. I guess it kind of felt like we would end up having this conversation, but I ended up telling myself, you're not necessarily going to say yes, even though I knew I was going to say yes, because I tend to say yes to these kinds of things. But the first thing I need to do is ask some more pointed questions. And for whatever reason, I ended up connecting with Esther about it. So I'm not sure what the decision was for you to connect me to her, but she was the person who I talked to at length with a lot of my hesitation. And so one of the reasons why I didn't, I don't know if I went into all the details why I didn't want to join, is that I had just stepped up. So I'd finished residency, started as an attending at a pretty, prestigious institution, and had just felt like it was a really toxic environment. And I think a lot of that has to do with just one, being a first-year professor, right? And being someone who doesn't really fit in just one group, and not feeling like I had the support of the women's group, or I had the support of even people who have been my mentors across those years, and not knowing really who to trust or go to. And the last thing I wanted to do was to jump back into some sort of organizational structure with people from medicine who were sort of the same people that I'd had this like huge sort of disconnection with around this time. I'd also, at this point, a year later, I was on the Hill, and I was in this, like, I'm going to advocate, change the world kind of space. Yeah. And I knew that just because, the popularity and the name recognition, that there might be a way to, if the leaders were interested in widening this and actually doing this the way that I think it could be done, and joining. And also, I grew up with, if you're going to complain, you got to do something about it.
Yeah, absolutely.
So no matter what, I knew I had to join. So I joined, and I'm skeptical, but I'm here and I'm involved. And I've actually been pleasantly surprised about like I think how well it's going, and I think how much we're actually listening to each other.
Did you feel like there was something Esther said to you or acknowledged to you on the phone that made you go like, these are leaders who are trying and really do get my experience or want to get my experience?
Yeah, so one, I Googled the hell out of Esther, whose name I'd known before, but she's written a great deal about not just gender inequity, but also racial discrimination and that kind of stuff, even though she's on the West Coast. And, you know, the style of talking about race is a little different sometimes. But I think once she intellectually understood the concepts, I think too she also sort of emotionally understood what I was saying, and I was able to be frank with her without feeling like I needed to sort of comfort her. And so one thing I said is that I'm really not interested in joining an organization that is comprised of just mainly white women in power who are doctors, because I don't think that represents me. And I would hate to be, you know, give my all and start to believe and trust in a mission only to just come back and be hurt. And I'm in a position where I don't really know, I'm not trusting right now, as, you know, I think a lot of, I'll say women of color, black women especially, are of the system in general. And I was able to say all this, and Esther was able to engage with me around it and say, you know, of course we're a group of women who are mostly white, right? And who are mostly at the, you know, leaders in their organization. So they may be these people who, you know, we're probably going to have these kind of disconnections, but there's a group of us, and we're willing to sort of amplify what your voice and the message that you're saying, and we're going to do it together. And she was going to be willing to sort of step in and give me the moment by moment kind of adjusting that I would need. And she also understood when I said, if I'm not comfortable, or if I think this is going in a way where I'm going to end up being hurt, or I don't think the mission is supporting, you know, a broad population, then I'll step away from it. And she said, I get that. And that was really, that was what, you know, Esther had, I think that meant a lot to me. So that's one of the reasons why I joined. And then, you know, we went to the first meeting in Arizona.
I feel like going to those meetings is so inspirational, but also so, it just like makes you want to do so many things. Yeah. Everybody comes from these really cool, fancy backgrounds where I get tons of imposter syndrome, where I'm like, I get why I'm here.
Even though you're like the one who got all this started.
Right, and I'm like, you know, I get why I'm here, and I know how I've got here, but I also hear these stories of the women and all of the amazing things that they do and how they got to where they are and the things that they've faced to get to where they are. And, you know, not just representing medicine as in physicians, but representing, you know, nursing, pharmacy, healthcare administration, physician's assistants, and having this like whole big population of people that like we work with on teams but don't hear about their experience as much as we should. Yeah. And I think it was really awesome to be able to be in a room and like hear about what they're interested in, hear about what we should be interested in about them, realize who's not in the room and who we needed to find and bring into the room, which is, I think, something we're still working on, which is we want to be everything to everyone, which is hard, but we also believe very strongly in that. And how do we get all of healthcare to come together over something we're all experiencing and say, you know, your experience might be different. This hierarchy is not helping, and that probably makes you scared to be in a room with me because maybe you had some problem with a physician and you're a nurse and you're saying to me, why do I trust you? Yeah. But we have to trust each other because we are part of the problem by not trusting each other, I think. And it's just really cool to hear those stories. And then also I think like as a psychiatrist who has had physicians as patients, who has had grad students as patients that are in sciences and has heard a lot of these stories behind closed doors, so to say, in a very HIPAA compliant environment. I heard this stuff and I knew it existed and I felt for it, but to kind of hear it from these people who had, you know, kind of just choked it down for lack of a better word, which is just like, I'm still leading this institution. I had to go through all this stuff to get there, but I'm still leading this institution. By the way, did you hear about all this stuff I went through to get here, but I never told anyone because you couldn't and no one would have supported me? Or I told someone and they told me to, you know, good, we'll call HR, and HR did nothing. And I just learned so much about like the process and the experiences of people. And I still do all the time, in part because I run our social media accounts and people contact us all the time about things.
And so you get all that, right?
It's a lot, but it's also so important that those stories stories are heard, and that I understand what it's like to be a pharma rep.
Yeah.
And be told that you have to
You
like
have to.
look pretty or wear a thong to get a doctor to look at you, or, you know, something that's just ridiculous where we would say, what?
Do you think everyone in the group kind of is able to understand those perspectives that may be completely different from?
I think that they're a group of people who really want to. I think that there are probably things that at times we don't understand,
Yeah.
but I think that as a group, you know, there's like over 50 founders, there's an advisory board of women that make up some powerful positions across healthcare as well. And I think that those women are really thoughtful about how they got to where they are and what that means and what they could do with their now existing power. I think it's interesting because in the room you also had some students, and I think some of the students were saying the kind of stuff I would have said as a student, which is like, I want to do this, but is this going to go on my application, and is someone going to not want me?
And that's been an interesting thing. But so when I was leaving my position and then being on the Hill, one thing that started to get to me was people not being able to speak up. And I understand, so I don't have kids. I didn't have sort of I think the ties that kept me at an institution that a lot of people do when they have a livelihood that's wrapped up there. But even I think some of the smallest slips are really difficult for people at all levels to kind of step in and intervene. And I'm not saying that it's some people don't notice when things are happening in the room where things are being said. But even afterwards, the number of people who would say, I'm so glad you said something, or I didn't know what to do, I'm so sorry that happened. And I will automatically put myself in this position to say something. It's just like a knee jerk, which usually is not always to my benefit. But I got to the point where I was doing that so much that it's draining, and also doing it for so many people, like students especially, or residents, who didn't feel like they could do it because they were in this position. And so when I got to Time's Up, one thing I was really kind of worried about was that I was going to have to take on that burden, but also wanting to take on that burden. So really at that first gathering, I was trying to assess where people were in terms of understanding, but also willingness. And I think one thing that definitely was clear, is that people were willing, which is usually the case, right? Like even if we're across different spectrums, but people were willing to want to know and willing to sort of have that conversation rather than shut you down. And that meant a great deal, that what I was saying was actually quite appreciated in that first time when I was there. Like that people realized that we needed to really be talking about this stuff. And I think that's always a really positive sign. It's one of the reasons why I'm still here.
Right.
I also, just like you were saying, it's kind of, and we're around the same age, but one thing that's getting clear to me is this difference between, I think we're in an intergenerational kind of position that is different than maybe our senior colleagues and our junior colleagues, in that I feel like the youth these days, which I guess is us, are the activism is so strong between like the Parkland high schoolers, between Black Lives Matter, between like AOC, all of these people who are like, we're not going to take this. And then you see how many of our predecessors have put up with so much. Like I cannot no matter what, like if I'm ringing a black, queer, whatever bell, like I have no idea how much, you know, someone who's been like a dean of a school of medicine who's a woman has had to go through to get there. And it's hard to kind of like, you know, to see, I'm glad that now they're able to find a place to speak up. And I think that we're working together to encourage this movement from both sides to say that we can do this, like give them the energy and they have the experience. You know, I think it's going to be hard sometimes because it's always like, what about me? What about my group, right? Which comes up. And I think that's a difficult thing because I think there's a historical context for each of our identities that might sort of be, you know, discriminated against. And if you have 1, 2, 3, or 4 of those, right, it should be acknowledged. But it doesn't mean you discount someone else's experience. So striking that balance, I think, is going to be a thing. But I feel like people are willing to do it.
How do we take these stories of Me Too, which inspired Time's Up, which is about action, and how do we not disregard those stories, but amplify them and use them to inform the message and use them to get further, or use them to say like what's actually wrong with the system? Like if you hear these stories, you know what needs to be changed. You might not know all the steps to change it. I wish we did, and I think we're working on that. I think part of our goals are, to do more research in the area, to really amplify the message and get it understood, to unify all the efforts under healthcare that are going on in every separate field to understand what the commonalities are and be able to work together on them, And I think we have these goals and we know what we want to do, but I think also understanding the lived experience helps substantially.
Yeah.
We can say, we've seen Title IX fail. We can say we've seen institutions fail. And we know very much that this is an institutional thing, which is why, I'm very proud that one of the things that we've done from the beginning is try to get organizations involved and institutions at the highest level to say, sexual harassment's not okay.
Right.
And we should be doing measurement and we should be caring about this. And maybe some of the institutions are not known for having been the best in some of this, for lack of a better word. But I think we're trying to bring them to the table because those are the people that also need help. Yeah. So yes, maybe we both went to a school that has had some problems and has been in the media for having some problems with inequity, at least. That's been vocalized.
Right.
And every school has problems.
Yeah.
And even the ones that aren't in the press definitely have problems, which I think scares them from coming to the table.
I can imagine,
but we're in this position where we're saying we want all these organizations, we want this to be a decision from the top, and no change is going to happen just because a bunch of doctors said no, or a bunch of nurses and doctors and physician's assistants and dietitians and all said no. It has to be deans, it has to be the APA, the AMA.
It's their community. Yeah,
it has to be these large organizations, large institutions that agree and help us push it forward, and that's where change happens, So I think we have all of these people on board. We've been trying to get more people on board.
Yeah.
We have, if I can name off the top of my head, a lot of hospitals. We have Brigham, Yale, Mayo, Brown.
As signatories?
Yeah, as signatories, which is, these organizations that are signing on to say sexual harassment's not okay, we should be doing measurement, we're going to come to the table in this conversation with other institutions and see what that gets us and where we can go from here.
Right.
What are best practices, and can we amplify those? And, people don't do measurement on this stuff. It's scary.
It's hard to capture to some extent. There are very clear instances of, in the harassment work that I was doing with my colleagues from Yale, some of the stuff is really hard to capture, right? There's clear this person stuck their hand someplace or said X, Y, Z.
Right.
But there's a lot of these dynamics you can't quite capture or put into words, which I also think is good that we're psychiatrists because we know that we have a higher, I don't know, but I feel like we're trained to sort of look out for those kinds of dynamics that might be happening in groups, even if some of our other colleagues are not. And we should be trained to sort of intervene. I think one thing you said is that we are used to sort of listening and supporting. I hope that all of us are able to also make sure that we need support ourselves. That's one thing that I've been a little more concerned about. I think I got to that point where I was sort of trying to fight every battle. But that's part of why we need a large group that represent all the different fields, because we can't do it alone. And it will be the communities and the institutions doing it with their leadership. But I think really bringing everyone to the table, which I hope we're trying to replicate within our leadership, but also at the institutional level, because we can't come in and just make those changes for them. So some of it is saying, yes, we're listening and supporting and having people step up and being able to sort of pitch in when, what their strength and and say, these are my blind sides and what my weaknesses are. So you can have these honest conversations. So that's one thing I'm actually, again, I'm really glad for you, for Esther, is that we can speak directly and candidly about how we might be feeling. And I think the benefit is that when you start to trust someone, you know that it's not intentional. So, you can step on my foot. I trust that you didn't do it on purpose, right? But it doesn't mean it didn't hurt.
Right.
And I think that I really hope we can get communities to actually feel confident and courageous to say these things and then actually have institutions do something about it. And it's kind of a scary thing about whether or not that's going to happen. But that's my dream of all of this, is not just gender inequity, sexual harassment, but some of the more subtle microaggressions and institutional sort of discrimination that happens, not having leadership that looks like you, or at least understands intellectually a lot of these issues, and then is aware in terms of policies, right? Just making sure that people are represented equitably in a lot of these positions where we interface with medical students and residents, and that you have a procedure in place where people can voice their concerns and have them followed up on. But I do think that I hope we can get there. I don't know, like, what do you
I mean, I'm really hopeful, to be honest. I mean, I think I went through med school, I just hated hierarchy. Everything about it, I hated.
Maybe that's what we have in common.
Yeah. I mean, I think part of it is I'm the fourth kid, and I was really used to, like, just saying what I was thinking. My parents really encouraged it. My dad definitely says everything he's thinking, and I grew up doing that. And I think when you go to medicine and they say, no, don't say that, little girl, you say, okay, well, I guess I shouldn't say that because they're going to grade me poorly, or I'm going to be told I'm talking too much, or I'm immature, or I don't understand leadership. And I hated hierarchy. Nothing about it made me happy. And this idea of sort of just like shaking it up and saying, like, no, like, the hierarchy is what creates inequity. It's what creates a place where someone can be harassed and not speak up. It creates these, like, unnecessary feelings between different specialties in healthcare that then don't feel safe talking to each other.
Yeah.
And maybe the same person is hurting different specialties of people on different teams, and no one knows because no one talks to each other.
Yeah, hierarchy, I guess, for me is a word that, for me, it's norms that aren't questioned that are harmful, and I think hierarchy contributes to it. And maybe I think to the extent to where older senior physicians who've been through all of these things, who have all this wisdom, I feel like that's a hierarchy or a system that we sort of need to respect in a way, but build such that they can share our wisdom with them in a way that's not completely demeaning, and that we are respectful for the wisdom that they have had. It's more of like I guess it is hierarchy, like a community where we all feel like we can share our perspectives and their value without, just some knee-jerk, like, oh, you're a resident, you're a medical student, you're not supposed to say or do that.
Right, and there's a difference between respecting knowledge and respecting position, or, it's just different to me. Like, I respect that people who've been around a while know a lot more than me about being around a while.
And they can be great mentors as well. But they're the best ones who are open, right, and who learn from you too.
Yeah. And if you were to say to, like, someone watching it at home, like, why should they care about Time's Up Healthcare, or why should they be involved? Like, what would you think?
Because them or their parents or their siblings or friends at any point are going to be interacting in the healthcare system. And we're there. And I think we're outspoken people who are also noticing what's going on. And we could be a lot better. It's not, I think it leads to an environment where there's not always a safety for the people who are supposed to be focusing on making sure you stay alive and that you're well and you get better. And that's not the way it should be. And so I think that's what I would like to say, is that we need to create an environment where, no matter how tense I guess it is on the street, which, I can't even get into the socio-political climate, but in healthcare, the main goal is to make sure that the patient gets taken care of, and all of these dynamics that, make people, the inequity, also discrimination, just creating that kind of hostile environment does not help us do our job. It makes us less likely to be able to do our job.
Right.
And that's the main.
And you and I were talking about how this relates to maternal mortality rates.
Yeah. Like, I don't want to die just like at 50 just because I'm a Black person who's educated and working in this environment. Or if I were going to have a child, like, to know that my rates of, despite my educational level, that my rates of mortality are higher. One, either going to the hospital as a patient, which happens with people in the medical field, but two, as someone who's a healthcare provider. I understand how you can carry a lot of this when you're trying to help people. So it comes out in all of these different kinds of ways. And I think it just gets to the heart of it. We really need to start talking about it.
Yeah, so talking about it, safer teams, more diverse teams make up for better healthcare for patients.
Yeah, and not just like saying more diversity, right? It's like, one, that should be a given. Two, people really need to understand why that actually is the case. Like, if it's reading the business literature, is it reading the studies, but knowing that diverse teams actually have better performances, and as business companies or as organizations tend to make more money and be more successful. So it's that diversity of thought which makes teams run so well, as someone who does a lot of this in my educational design. But then three, I think it's like this trust situation. Like, no matter where you're from, and what your sort of values might be, you have to be able to leave that at the door when you come to work as healthcare. And I think building that trust as just like a human is one thing that also helps us have these conversations and know you're not intentionally stepping on my foot in that kind of way.
Right. Or if we did, we say,
sorry,
fix it.
My bad, right?
Do something better next
Not like
time.
you stood in my way. Yeah,
absolutely. And I mean, and I would say to like anyone at home, we have a great website. You can go timesuphealthcare.org. You can follow us on any of our social media accounts, which is just at TimesUpHC. And that's actually run by me right now. But all of the information.
Make sure you say when you need some support, Jessie.
Right, absolutely. And all the information there, I think, will at least like inform you on the issue. If you don't know a lot about it and you're just curious and want to be an observer for a while, that's a good place to start.
Yeah.
There's a place on our website where you can sign up and join us, and that'll get you a newsletter eventually, and that'll get you more involved in the conversation. You know, I think that that's a really easy place to start. I think if you're an institution watching or organization watching, we're obviously still looking for signatories.
We are, and we love having
involved.
this conversation at different organizations and institutions because it's sometimes easier to have someone from the outside come and facilitate. I also think many of us, as I mentioned with Esther too, we write either more narrative sort of platforms or even in a more sort of formal academic platform about these issues. And so trying to look up some of the literature that's been written on this, either through our own web pages or contacting us, is another good way of getting that education on yourself.
Totally. There's a lot out there, which you'd be surprised to realize how much there's already been out there that's out there. And then we're working really hard to put more out there because I think that that's also important. So people can find what they need to be learning and reading, and we can comment on things that are happening as they happen. And, you know, if you're a journal person, maybe think about putting more gender equity in your journal.
Right.
Because that's also important.
Yeah.
Like, no one's going to know it doesn't exist, or it should be valued if these other places that are gatekeepers are not helping. So, you know, think about putting women on your review board. Think about having women editors, but also like just put more of this literature in because people need to learn. And as academics, people often don't turn as much to the press where this maybe is more, and they should read some of these journals and be able to say, like, this actually is real, and these statistics are valued, and JAMA says so therefore it is.
Yeah.
You know?
Yeah.
And I think that it is there, and they can find it if they look. And there are a few articles for sure that are in JAMA and New England Journal of Medicine that are written on these things that are written by a lot of the people that are founding members.
By us,
But I think, you know, you can't. It's there. The evidence is there. There's not much you can discount there.
I just want people to try. Just do something. No matter what part of the spectrum you're on in terms of experience or knowledge about this stuff, just try to move one step up and just keep trying because it makes a difference.
Yeah, totally. Especially even for men.
Especially, yes.
Yeah. We have this conversation and people say, like, are these movements also anti-male, right? And they're not. We need men at the table. They're the gatekeepers at all levels. And we're so aware of that. And we made this really awesome video when we launched that had a bunch of allies saying time's up, and they were men. And that was important because we were saying the men are with us, not against us. Right. There are men who want to mentor women and are not scared because they can't be in a room with a woman. Right. And that's what matters. Like, we do need men to support us, especially until there are equal
and I hope
numbers.
They join. Yeah, because we'd also like to hear about their experiences as well and what we can do if there's, you know, if they're in a situation that is like our blind spot that we're not seeing.